Okay, are we ready?
Yes.
Hello, everybody. It is good to see you. This is our holiday version of Get Well Wednesday, and an incredibly important one because we have a really, really important and special friend and guest, and someone you're all going to get to know extremely well, a little bit today, and then over the next several weeks, months, and years ahead. So I'm here with Deepthi Bathina. You've gotten the notes about this. Deepthi is the new CEO of our combined company, GW RhythmX. Deepthi, welcome to Get Well Wednesday.
Thank you. It's such an honor to be here today and truly be a privilege to be in this Fireside Chat and to be meeting with this great community, which I've heard wonderful things about, and really excited for this conversation.
Good. So, guys, I was letting Deepthi know that these are like rapid fire sessions. So we don't have lots of time together, but this is an important time together. So we're going to tackle two topics in about 25 minutes. Topic one is going to be, I just want you guys to get to know Deepthi. This is truly a healthcare visionary, a technology visionary, and now a dear friend who I've gotten to know so well over the last 2 years. And I'm so excited for you to get to know her the way that I know her. So we're going to do that first. And then we're going to talk about the future vision of this new combined company that you are leading. And we're so excited to hear about. So first of all, just tell the Get Well community about your personal background. Where are you from? What shaped you kind of growing up? Give us a little bit of the who is Deepthi?
Thank you, Michael. So I'm Deepthi Bathina. I grew up in a very small town in southern part of India. My name Deepthi means light in my mother tongue. And where I grew up, a lot of things we take for granted now were completely missing. We were a close-knit community, and even basic chronic conditions like diabetes. My grandmother, pure lack of awareness how to control diabetes, access was a huge issue. By age 67, her foot got amputated because of diabetes, and she passed away soon after. And this is just one story. In the community, a lot of people lost a lot of loved ones for the lack of access, lack of patient education, lack of awareness. And that deeply shaped me today, who I am about nobody should lose their loved ones for things that could be solvable easily with increase in access and education.
No doubt. Thank you for sharing. And at least as we learned here in the US, our healthcare system is perfect. So there's nothing to do. But anyway, no, but thank you for sharing. So now let's talk about a shift from your personal background to professional. So you've had this really cool, and in many ways for me, envious career building and leading really large products that had lots of impact. Can you kind of just take us through a little bit of professional history that is leading you here today and a couple of like big milestones along the way, if you don't mind?
Absolutely. Thank you so much, Michael, because first of all, you are one of those rare entrepreneurs who built Get Well, made it a true leader in the digital patient engagement space for decades. The whole thing we stand on right now is because of your brilliance and genius in work and passion. Thank you for your kind words. So from my career perspective, right, I came to Boston 27 years ago to do my master's in computer science. Never left. I still live in Boston, by the way. I just travel all over because RhythmX is headquartered in Palo Alto. Get Well is headquartered in DC. And you already know which commute I like better. And I'm shuttling between both places right now. And worked for like first decade of my professional life as actually a software engineer, developer, and an architect, right? Back then, I used to think it's a baggage. It's like, oh my God, too much tech background. What am I doing for like 10 years? But now in this crazy world of AI moving at warp speed, to have that level of deep understanding of technology, I am finding it as a great source of wisdom and energy. And about 15-ish years ago, I got promoted to a COO role for UpToDate, which is very widely used by most clinicians in the country and several in the world too. And to be very honest, initially I was like very excited, more professionally, functionally, to say, oh wow, I get to run operations for 170 countries and I get to do this kind of thing. But once I joined, I started traveling to public and private hospitals all over the world. And when I started hearing stories about how technology helped them, these tech-enabled products really help not only improve lives but save lives, right? First time in my life, in these customer meetings, I literally had tears in my eyes to say, oh my God, something I'm working on actually can touch and save lives of so many people versus you working on some product which makes a rich attorney get paid some invoice quicker kind of product, right? And that's when I decided I'm extremely passionate about technology, and nothing felt more meaningful in life than improving healthcare for people. And I decided to dedicate the rest of my life at the junction of healthcare and technology, leveraging technology. How do we keep on transforming healthcare, right? So ever since, if you look at it, that's all I've done. I mean, after that, Nuance, which is acquired by Microsoft now, and where I led operations is where AI solutions for physicians and clinicians, speech products. And then after that, I was a chief product officer of Humana. I've led for about $76 billion in P&L, Medicare, Medicaid, commercial, all products, customer success. And it really humbled me to visit patients at home to think about how for extra $100 per month, they would have to suffer consequences like amputated foots and things like that. And I would be like, we actually have a plan in place. You should be getting help. And communication broke down in the healthcare ecosystem. You could put all the plans and benefits you in place, but I've noticed that does not mean it makes it all the way to the patient who should be receiving it. So just by being in so many chairs as a payer leader, technology leader, health content all around the world, it humbled me so much about the enormous depth and breadth of problems we have to solve in the industry today.
It's so good, and you know, as I take kind of listening to you about your career, you have been so close with products that are at the essence of our user community. I mean, these are folks who are literally at the point of care on a minute-to-minute, day-to-day basis with patients in a very vulnerable moment. And what might we be able to do to provide some tools to help these folks who were both born and trained to deliver patient-centered care? How can we kind of help them fulfill that mission? And the things that you've done are so relevant to that. And those of you in the Get Well community know we do a lot around these patient stories unfold every minute of every day, you know, to the tune of about 10 million patients now a year that you all are taking care of with our tools. And so, Deepthi, when I first met you, and I first saw the new product that you've been building for the last year and a half, RhythmX AI, I was so blown away by how close the touch is with what you're building to the actual delivery of care at the primary care level. And you started our first meeting ever with your kind of why that you kind of got into the work at Rhythm. You left these massive jobs to come do this crazy, tiny, little nascent startup to build something that could be really important. And so would you mind just quickly sharing the story of your why on why you jumped over to do the Rhythm project? And could it be great for our community to understand like where you're coming from on this?
Absolutely. The reason I'm part of the whole family of Get Well RhythmX right now is, as you said, I'm the founder of RhythmX AI. Again, very fortunate and a privilege and high gratitude for Symphony AI Group for funding our company. Is this, right? In a lot of really large companies I've been at, the word innovation is used in a very diluted way, right? It's about a little feature here and there. I wanted to work on something truly revolutionary, not just evolutionary, but truly revolutionary. And I'm very excited by Symphony AI Group, which we are part of now, committed $1 billion funding into the AI platform that cuts across the portfolio companies, the data assets we have access to the sister companies, 300 million patient records, and also the ability for us to have a company like GetWell to be part of this family with marquee foundation, trusted by 150 largest health systems over decades. This is not an easy thing to have these kinds of gigantic assets in the same family, right? And very committed to something very revolutionary. So with all these assets like great companies and great capital and data, what do you solve, right? And that's when we spoke about like 100 different health systems to be able to look at it. And one of the biggest problems is to be able to help clinicians and patients experience right care at the right time through the right clinician is extremely important, right? Easy said, but very hard to do. And how do you, to be able to do that, you have to convert intelligence into impact. And I say that because there's a lot of insights, intelligence all over, but you have to connect these dots and say what's impactful to this patient. So you take the example of this inpatient, who could be a care manager, and you have a patient in front of you. Guess what? There are 25 different areas where insights about this patient reside, right? Here is this patient's clinical information. Here is this patient's social information. Oh, this patient also has a health plan and a formulary. By the way, this patient has Hispanic culture and doesn't speak this language. Now, you have 10 minutes with the patient and you want to be looking at the patient and show compassion and be there for the patient versus using all that 20 minutes by the bedside, looking up thousands of data and you're formulating, right? And that's where RhythmX AI Precision Care AI platform comes in is we look at 10 different data sources inside and outside EHR, evidence-based guidelines, health plan, formularies, all this information, and we put extremely advanced AI on top of it. And then we clinically validated 25,000 clinical validations have been complete. And then that's what goes to the clinicians, could be nurse practitioners, could be physicians, to be able to say, what is a hyper-personalized treatment for this patient today? What is this hyper-personalized education for this patient? How do I engage this patient as part of this journey, right? So this is truly revolutionary work, and everywhere we've shown the demo, everybody has been really wowed. And I welcome all of you who are listening today. Please reach out to me, and happy to arrange for demos because I truly want you to experience this next gen work.
I love this. And there's a couple of cliches that we all know in healthcare, and one of them is always, at the end of the day, despite all this tech and all this scale, if you will, healthcare is local and healthcare is personal. I was always so blown away. You have one of these whys in this particular journey that is so compelling that it made me want to I just want to spend time with you to understand what's driving you, because it is so personal and what you want to go fix. Can you just quickly share like your leap into this particular work at this stage? Because I think it's a very important story to share.
Absolutely. I actually have one personal story, not only market research, but personal story that actually happened this year. Happy to share with you is I've been married 25 years now, just celebrated my 25th wedding anniversary. And my husband, who is now 50, is a marathon runner. And late last year, he actually went to a primary care physician's office with all the stress tests, lab results, everything done, right? And the PCP looked at everything and said, great, go run marathon. And he runs marathon. And later, he's an AI engineer. And as he was looking at all the labs and he was trying to test by putting all this information into the latest AI models, the AI caught actually and said, you have a silent cardiac condition. You should go see a cardiologist right away. And guess what? He ended up going to a cardiologist this Jan of this year. And by March, he had an open heart surgery because he had a silent cardiac condition with 3 anomalies. Literally 3 anomalies, which are very tough for human beings to even detect. And because of that, his life was saved because of how AI helped. But how many patients we serve are going to have AI engineers sitting in their home trying to do this, right? And in this whole process, my greatest sympathy goes, first of all, I feel extremely fortunate and lucky that we found this for my husband, and he is happy, healthy now and running again, right? But you know who my sympathy lies with this is a physician. Because we expect superhuman behavior out of every clinician. There is thousands and thousands of data points about each one of us right now, right? Too much data, which has converted every patient into a project manager and every clinician into an administrator. And we expect superhuman behavior that in that 20 minutes the patient is here, I'm supposed to pay attention to you, I want to be compassionate with you, and am I expected to read 10,000 things about you and decide, pick up the signals of what's not there and detect and say, oh, this is a silent condition, or oh, this is a treatment that works best for you, or this is the education you need, this is how I should engage. Which superhuman can do it, right? And this is where technology can do what it's best at, and human beings, we can do what we are best at, is the human touch, the compassion, the care, right? In our most vulnerable moments, I want to see you, not some machine. Totally. Let machine do what it's good at.
Yeah, I love this. And first of all, I'm so happy that he finished the marathon. I'm happy that he was so activated in his own care that he was a participant in finding his way to what might have been an anomaly. And I'm so happy that he is okay. These things are really important. And I'm actually so happy, and our community will so appreciate, you know this, these are the kinds of personal drives that are required to like push through all of the obstacles that are in the way of our users, that are in the way of you, that are in the way of all the things that we're trying to accomplish. And sometimes these personal stories and passions get us through these really late nights and early mornings. So we're not happy that you had to suffer, your husband did, but we're happy that you've been through it, because it kind of creates a different drive.
And if you look at the stats too, 1 in 7 people have something right now undiagnosed that we don't even know of. And
now you're going to scare all of us.
No, that we should be scared.
Yeah. Totally. So all right, now I want to turn to the business a bit. Okay. So you are leading, and we're involved together in this putting together 2 companies that are very different. You have a 25-year-old company, and you have an 18 to 24-month-old little baby company that is doing incredible things. And your job is a hard one. How do you fuse these 2 companies together to create a sum that is greater than the individual parts? Yeah. And how do you do it in a way where these customers, these users, not only hear from us, but they feel the impact that they want to feel on better products and better service and innovations and things? Can you talk a little bit about like this process and how you're like leading through it a little bit so they understand what's happening inside these walls, if you will?
Yeah, absolutely. For me, this is an extremely powerful combination of 2 powerhouses in 2 different ways, right? On one side, we have here GetWell, literally a leader in patient engagement space and marquee client base with earned trust over the decades and domain expertise in healthcare. Healthcare is not for the faintest of hearts, right? And I sincerely believe in the scars of healthcare, the learnings, or what would make even the world's best technology into the reality to convert intelligence into actual impact, right? And the domain expertise that GetWell teams bring is unparalleled. I am wowed by the depth of expertise of patients, of people who understand patients and clinicians and the needs and the workflows inside out. Hundreds of integrations done into workflows, literally. And outside the trillion-dollar giants like Microsoft, you look at health tech companies, who has this kind of scale, the depth, the domain, and the trust of 150 health systems, right? So that's one powerhouse. And now you look at RhythmX AI, right? We headquartered in Palo Alto, brilliant AI engineers and product leaders, literally with PhDs in AI, countless number of healthcare AI patents, huge capital investment, literally $1 billion investment going into the platform. And you look at everything we have, what we built there within max 2 years. We are live at Presbyterian, New Mexico. We went live with 30 physicians end of this July. Within literally 2 months, I made a decision to expand enterprise-wide. Paperwork took another month. Now we are live in 100 plus more physicians who love using the revolutionary technology to say, wow, this really helps us deliver hyper-personalized treatments in a very meaningful way. And 100 more physicians, up to 200 plus, are getting it in 2 more weeks. This is the speed and the cutting-edge AI that healthcare has never seen. We presented it at Becker's conference, standing room only. We had to turn 50 people away. People are like, this is medical super intelligence. That's what they're calling RhythmX AI. And they're like, we've never seen this level of medical super intelligence. Again, fully clinically validated by physicians, right? And now you bring this powerhouse and GetWell's trusted domain and strong foundation together. We are truly defining a new category of precision care AI that will serve end-to-end patients, care teams, clinicians, specialists, and build system-wide orchestration. So your patient could go anywhere. They could go to a cardiologist, PCP, inpatient, ER, shouldn't matter, because the central brain of intelligence from multiple sources and advanced AI would power every persona to be able to say, what is the right step for this patient, right care at the right time, right? Right. Nobody has done this, and we truly are positioned very strongly to deliver on this vision.
I love it. So under your leadership over the last 6 to 9 months, we have been standing up a new innovation center to help kind of bring these two pieces together and to be able to kind of bring the future faster for our users through products and all. Can you just like comment on like how you envision the pace of innovation moving forward and the kind of things that this community should expect to see and kind of when? Can you just share a little bit of how you're driving that?
Yeah, sure. The pace of innovation, first of all, is mind-boggling to me, right? I've been in like technology all my life, and now by the time this meeting is over, technology would have evolved. I'm already outdated as of right now. Warp speed, right? And sometimes I'm surprised positively by, oh, what used to take 30 people 7 months to do, now this can be done by 3 people in 3 hours kind of thing, right? And that's where what we want to be able to do is, in the next 3 to 6 months, I would say we are ruthlessly prioritizing on healthcare. Like I said earlier, part of this meeting has a lot of problems, right? We will be speaking with all key clients, and I've already begun in the last 2 weeks. I spoke with about 8 to 10 of our customers already about understanding what are your highest priorities? Where is your biggest need? Ruthless prioritization is my 2 favorite words, because if we don't prioritize, we are not going to boil the ocean of healthcare in our lifetime, right? Those conversations already begin. As you, of course, know, Michael, in the next 2 to 3 months, I have literally like every week conversations going on. The goal is by end of my first 3 months, I would have met vast majority of our clients and truly understood in your voice, your highly prioritized needs. We'll build a pattern across, number 1, we've got to do this for our clients. Number 2, number 3. And that's where we will take this innovation already built and start fast tracking towards these prioritized products. So if you're hearing this conversation and you're like, I want my voice to be heard and I want to share where our needs are evolving towards, not only today, but even 1 year, 2 years from now, where are we headed? Please, I'm at dpb@rhythmx.ai, or reach out to your GetWell contact and have them get me in touch. I want to hear from you and your needs as well. So please reach out.
I love this. We have about 5 minutes, and I've got 2 more things that I want you to share. I'd like you to share. The first is, can we like pull back now? So it's so exciting to hear how fast folks will feel the innovation coming throughout next year. But if you like pull back, can you share a little bit of like, hey, I'm now running this new combined company, GW RhythmX. I have a really big vision for what we can do in care. Can you just give us like a 30 to 60 second picture of like the big idea and where you think this is going?
You mean from the care perspective or from the company?
From the care.
Yeah. So from a care perspective, where I think we are headed is, first of all, whether you're typing or speaking, the natural language processing has to be baked in. That's becoming table stakes. in the current world. It's like truly table stakes,
Yeah.
right? Where another opportunity for you to be truly focused. And the true care is to be able to say, pre-care, before the patient even walks in and you see about the patient, envision if you could to be able to say, hey, this patient here, before they even coming in, they've been depressed, they couldn't afford this medication, and they just went to ER 2 times, and they speak Vietnamese, and this is what they do. These are the 2 things you could do. Oh, by the way, you could be missing this diagnosis. They already have this condition, and it's progressing also. Imagine before the patient even walked in, you heard the top 3 things about the patient that matter the most. Now imagine, if you will, you're sitting right next to the patient and they just said, I have stomach bleeding going on right now and diarrhea, right? That could be 8 different differential diagnoses right there. And for you to be able to get an answer within microseconds about patient just said they're having bloody diarrhea or stomach pain. What could it be? The answer for Michael will be very different than answer for me. To be able to get right there, for this patient, number 1 reason could be this, right? Literally, and this is happening. What I'm speaking about right now, rhythm is already being used at the point of care while the patient is there. It's truly like magic. And remember, when the patient leaves, you're able to send them away with the right education. And once the patient leaves the hospital or the clinic, even in the comfort of their home, you know exactly when to engage the patient, what to say, how to say. So you're continuously keeping them on the healthier loop throughout the continuum of care. That end-to-end serving both the physician, clinicians, nurse practitioners, care teams, and patient is, a lot of this is already a reality, and this is where we'll be rolling out pieces. But again, not before I hear from the customers first. So that's very important. But imagine, if you will, and this is not even science fiction. It's already happening.
I love this. This is the kind of care that I would want to receive. And so the fact that we are a part of a company that can be a pioneer in helping to deliver that to the masses, but in a one way, is a pretty fabulous reason to stay up late and get up early.
Every other industry, I look at it, I feel like you go to Amazon Prime. Amazon Prime already knows. It'll be like, Deepthi, I think by now you would have run out of your Sumatra coffee or this. You should be getting it. Or I go to Netflix. Oh my God, Netflix has figured me out. It's like, I think you will like this. And I'm like, yeah, now I'm binge watching this, right? So the thing is, there's so many industries that hyper-personalized and figured out each one of us what to say, how to engage us, right? Healthcare is like miles behind, and that is the industry where we need to do this for the greater good. Nothing happens if I don't watch one more Netflix episode, but healthcare we need to. So I think time has come. I'm very excited about the opportunities ahead for patient engagement.
It's so good. Well, listen, Get Well community, we are going to close out by wishing you an incredibly happy holiday season. And let you know, Deepthi and I's work together will continue for a long time. My new role has actually also been candidly quite exhilarating, having a chance to kind of pull up and back from the day-to-day business to see the world, you know, in a big picture way, and to be a resource for Deepthi as she actually guides the company through what we're heading through has been an incredible first 4 weeks, and I can't wait for the next 4 years to be doing this with you. It's going to be a great run.
The word resource doesn't even cut it. Depending on the day, Michael is my mentor, advisor, therapist. Also some days, and a dear friend, and my work brother too. So thank you, Michael. Truly a privilege to work with you. And those of you who are listening, please, if you're interested and could spare even 15 minutes, reach out. I would love to meet with you and hear your voice and your thoughts and about your needs. Happy holidays, and thank you so much for being our clients.
Thank you all. Happy holidays.